So this is a very interesting study from Seattle where Page and coworkers examined the records from the emergency response system and found 800 and some records of cardiac arrests in different venues around the city of Seattle. The surprising information was that out of that 800, only 52 occurred in formal training centers or gymnasiums. One would think that that would be a higher risk location, but it turns out that the majority of these cardiac arrests occurred outside of exercise facilities. And when they did occur in any other exercise facility, it was usually a gymnasium where people were playing a pickup game of basketball or a dance studio or some other non-formal exercise program. The other finding, which I thought was very interesting, was that in the survival statistics from the different locations, the best survival came from the formal exercise facilities. There were other facilities. There were non-exercise facilities, but if you looked at the survival rates, your best chance of surviving was being treated by the local people in a formal exercise facility. There, the incidence of recovery from a cardiac arrest was highest. However, the discharge from hospital after cardiac arrest was the same for all the locations. So I think the implications here are that, number one, it's probably reasonable to have external defibrillators in formal exercise facilities. That's at least a location where you can deal with them because the people seem to be trained. However, with the great majority of cardiac arrests occurring outside of exercise facilities, it's going to be very difficult to figure out where to put AEDs in general. Right. Well, Page and coworkers did an analysis looking at the risk of an arrest in these different locations. It was once every 42 years in a health club or fitness center. It was once every 11 years in an indoor tennis facility, for example, and it was once every 536 years in a dance studio. So the real question is, what's the economic justification or even the functional justification of putting an AED in a location where, for example, a hotel gym where the risk is once every 731 years, according to their calculations. I think a formal gym probably should have an AED just because it's the structure of the gym and the people that have some responsibility for the health of the participants. But if you talk about once every 536 years of risk, I'm not sure you have to have an AED in a dance studio, for example. Some of the things, tennis facility, once every 11 years in their calculation, maybe you should have one in a place like that. I think depends on the economics. If people want to buy an AED and put it in, they should be pretty well aware that they're not going to use it very much. They need to have ongoing training, so there is some expense involved. But in some locations, it's worthwhile having one.